everyone. This is Monica Cuza with Get Onda Magazine, and today we have an exclusive interview with the President and CEO of Harris Health System, Dr. Esmaeil Porsa. Hi, Dr. Porsa. How are you today? It's a great pleasure to be here with you.
Good morning. Thank you for the opportunity.
Thank you. No, thank you. So let's get started with a little bit more about you to get to know you, the Hispanic community. So I've learned that you have an extensive career in medicine and healthcare, both as a provider and administrator, correct?
That's correct.
And you have a long career history here in Houston. So would you tell us a little bit more about your schooling and your connection with Harris Health and Harris County?
Sure. Let me start. First and foremost, I always like to start by saying thank you to all of our employees and staff at Harris Health System. And again, thank you for this opportunity. To get to your question, I actually, starting with college, I went to college in San Antonio, Our Lady of Lake University, small Catholic college in San Antonio, got my degree in biology and chemistry.
Okay.
Went to medical school in San Antonio as part of the UT Medical School. Came to Houston in 1993 to do my training in internal medicine at UT McGovern Medical School. After 3 years of residency, I was a chief medical resident. It was a great honor to be a chief resident with the UT Medical School.
Wow.
All those trainings, the 3 years of residency and the chief resident year, majority of it was actually at LBJ Hospital.
Okay.
So very familiar with LBJ and the
Yeah.
community that it serves, and Harris Health System. At the time, it was still Harris County Hospital District. After my chief residency year, I was actually a faculty member at LBJ in charge of the emergency room at LBJ Hospital. After which I started working full-time at Harris County Jail, actually taking care of inmates.
Wow.
And I did that full-time for about 10 years.
Okay.
Really enjoyed that work. I was a frontline provider taking care of the detainees at the Harris County Jail. In 2007, I was recruited by Parkland Hospital to run the Dallas County Jail as their medical director.
Wow.
I did that for 4 years before moving into the administration at Parkland Health and Hospital System. For those who may not know, Parkland is a safety net hospital for Dallas County, similar to what Harris Health System is for Harris County. Initially, as the Senior Vice President for Medical Affairs, I was in charge of the graduate medical education and also the medical staff office, which does the credentialing and privileging of all the providers. And then as their interim chief medical officer, when the old Parkland Hospital closed and the new Parkland Hospital opens its doors. And last few years in Dallas as their chief strategy officer, before moving back to Houston as a homecoming, starting my new role as President and CEO of Harris Health System on March 2nd, 2020.
Oh, wow.
And that was the week that we had our first COVID patient in Houston. So it was a trial by fire.
I imagine. Well, I can actually not imagine. And that was actually my next question. That it was my understanding that you started with Harris Health System in March 2020, and how challenging that was for you.
You know, starting any new job is challenging. I was a first-time CEO. That was challenging. Harris Health System is the largest safety net hospital system in Texas. That was challenging. What nobody expected, least of which myself, I did not expect that I would be dealing with the global pandemic at the same time. But I think what that opportunity, and I always see every challenge as an opportunity, what that opportunity allowed me to do was to really get to know our system on a very personal level. Because of the lack of a lot of activities outside of the hospital system, as you can imagine, everything was shut down, right? It provided me with that opportunity to get to know our staff. I continue to visit our hospitals every Sunday, something that I continued from the time of COVID, and it really, it allows me to stay connected to our staff, and what are some of the pain points, what are some of the things that are working well, some of the things that are not working well. So that has been the impact of COVID, one of the impacts.
One of them. It was challenging, but at the same time, it looks like you benefit.
It did. I always say there's a silver lining to everything. Every challenge is an opportunity. In addition to getting to know my employees, it allowed me to actually get to know the other Texas Medical Center hospital system leadership.
Right.
Because, we were forced to really get together and work at this collaboratively.
Right.
We met every morning at 7 a.m., including Saturdays and Sundays,
Wow.
for more than a year. Because we all realized that for us to be able to address this challenge, it was going to take all of us.
Correct.
So that was another blessing.
Wow. So, as the president and CEO of Harris Health System, what would you tell us? What would you like to tell us a little bit more about the Harris Health and what's unique about it?
Sure. A lot of things. Everybody I think understands, most people understand when I say a safety net hospital system, what that means, right? Mm-hmm. Almost 60 years ago, the residents of Harris County voted to create Harris Health System, at the time, Harris County Hospital District, with a statutory mandate to take care of the indigent, the uninsured and underinsured, and I think people understand that. But Harris Health System is so much more than that. Folks know about our hospitals, mm-hmm. our level 3 trauma center hospital, LBJ, level 1 trauma center hospital, Van Top Hospital, where in addition to taking care of the indigent, we take care of the entire Harris County and City of Houston. When people are victims of trauma, be it a stabbing wound, be it a gunshot wound, be it a severe motor vehicle accident, they come to us because we are one of the few hospitals in this area that can provide that acute care.
Okay.
That's for the entire City of Houston and Harris County, not just the indigent. On top of that, and this is something that perhaps people don't realize, Harris Health System is the major training grounds of the doctors, nurses, and techs for today and tomorrow. Every year, Harris Health System trains more than 3,000 residents, fellows, and medical students. Currently, 45% of all the doctors who are licensed to practice medicine by the Texas Medical Board, mm-hmm. they have done their training at Harris Health System. So even though you yourself may not receive care at Harris Health System, chances are your doctor did their training at Harris Health System.
Wow.
Really important. And I think you may be familiar with our economic impact study that we did earlier this year. We wanted to see what is the economic benefit of Harris Health System to this community, mm-hmm. and come to find out that for every dollar tax support that Harris Health System receives, we return back to the county almost $6 in economic impact. Last year alone, that amounted to $5 billion in economic impact to Harris County. Really important. And then something that people don't necessarily focus on is that as the safety net hospital, Harris Health System is really foundational to the entire healthcare ecosystem in Harris County and City of Houston. We are one of the reasons for the success of the Texas Medical Center. And I'm going to explain very quickly what I mean by mm-hmm. that. If Harris Health System was not able to provide the services that we do, which is taking care of the indigent and uninsured, which unfortunately, because they don't have access to primary care, they show up to our emergency rooms, right? Right. If we were not here to provide that service, they would go to somewhere else, and that somewhere else is all the other emergency rooms in the area. That's all the non-for-profit and for-profit hospitals. When that happens, if that were to happen, a couple of things. One, access to emergency care for all of us would diminish, because now the emergency rooms are going to be full with patients that used to come to us.
Correct.
Number two, the cost of care would go up because emergency rooms are very expensive. Yes. That increased cost of care would initially get transmitted to the private insurance companies, but then the private insurance companies will turn around and transmit that cost to all of us who have health insurance, and that would translate into higher insurance premiums and out-of-pocket deductibles. So Harris Health System as a safety net does so much more than just caring for the indigent. Talk about our hospitals. In addition to that, we have 40 other sites that take care of our community in terms of our community health centers, our specialty services, our freestanding dialysis center, our freestanding dental center, our healthcare for the homeless program, our mobile units that provide medical, dental, and mammography services, and so on. So we are truly a community-based organization taking care of the entire community and not just the indigent.
Wow. Yes. And among all those challenges that you just mentioned, what would you say are the biggest other challenges compared to traditional hospitals?
Is the funding. So as you can imagine, our funding mechanism is very different than a traditional hospital, right?
Mm-hmm.
So two things: one, funding, and the other one is capacity. Starting with the funding, in a traditional hospital system, when you have a high percentage of patients who have private insurance,
Mm-hmm.
as your cost of care increases, you are able to address that increased cost of care by renegotiating your contracts with the private insurance companies. So you're able to cover that cost of care plus a margin. In the safety net hospital system, two things. One, our mission is not about margin. Our mission is to serve the community.
Correct.
But having a very, very small percentage of patients who have private insurance, we do not have that luxury to cascade our costs down to a private insurance. So we have to be extremely efficient, and we are. When you compare our numbers in terms of the cost of care per patient, we do extremely well. We are one of the cheapest providers of care, really important, but at the same quality, if not better quality, than some of the other hospitals.
Wow.
So extremely efficient, but still high quality and safe. That's on the cost part of the difference between us and a regular hospital.
Mm-hmm.
The second one is capacity. A normal hospital operates with around 80 to 85% capacity every day, because that allows you the flexibility to flex up or down depending what's going on in the day.
Right.
In Harris Health System, and I don't know how much folks know about this, every day both of our hospitals are at 95, 100, sometimes 105% capacity. And you may ask yourself, how is it possible to be over 100% capacity? That's when we actually have patients and hospital beds in the hallways of the hospital. So we go over our capacity because we have to.
Right.
Because there is just no room in the hospital to take care of the patients. But as you can imagine, the patients keep coming to us, and we want to be able to provide that service to them. So we are always at a situation where there is very, very little flexibility. And when you consider that, and then also realize how efficient we are, it is really a testament to the work that our employees, that our medical staff are doing, taking care of the patients with such efficiency, despite all the challenges that they face.
Right. So I guess that's where this 2.9 billion facility plan comes into play. What would you like the Hispanic community to learn more about that bond and that plan?
Sure. So the bond is a $2.5 billion bond because that's our borrowing capacity, but you did mention the $2.9 billion. When you look into the next 12 years of our infrastructure needs, which we, again, because of our capacity, because of the age of our institutions, and also because when you imagine that they were built 30 years ago, we have not had any new hospitals since then. The population of Harris County was less than half of what it was today. I started my training at LBJ Hospital 4 years, I think, after it opened its doors.
Mm-hmm.
The population of Harris County was 2 million. Now we're talking about a population of 5 million.
Wow.
Unfortunately, we have the highest number and rate of uninsured in this county compared to anywhere in the nation. So the needs have increased, but our capacity has actually decreased because 30 years ago, LBJ and Bentau both had quad capacity rooms, 4 patients to each room, which is never a good idea. But that was changed, thankfully. Now we have 2 patients to each room, which is still not ideal because really you need 1 patient to each room.
Right.
So lower capacity, higher population, that's one of the reasons for our capacity issue. So that $2.9 billion is to address some of our capacity issues, which includes creation of a new level 1 trauma center hospital on the LBJ campus. This would be the 3rd level 1 trauma center hospital in a county of about 5 million people that really needs about 5 level 1 trauma center hospitals.
Mm-hmm.
But the first of its kind outside of the Texas Medical Center. So really serving the entire north, northeast, northwest region of Harris County with a large population. It would also allow us to refurbish the existing LBJ hospitals that can provide some of the other services that this region needs desperately, and some of the services we currently cannot provide. That's inpatient psychiatric care, emergency psychiatric care, and outpatient psychiatric care, in addition to chronic care facility. Add to that is $400 million investment in increasing capacity at Ben Taub Hospital in terms of 120 additional hospital beds.
Okay.
And the last but not least, something that I'm really proud of, is a $500 million investment in our community. That's 3 new clinics. In addition to replacing some of our older clinics, we have some clinics that are actually over 50 years old and are truly falling apart, but then also adding capacity and capability to our existing clinics. You add it all together, that's $2.9 billion. Our borrowing capacity is $2.5 billion. That's what is on the bond proposal. The other $400 million over the next 12 years. We intend to bring that in through operational cost savings, basically operational cash, and also through philanthropy, which I am really excited that even before the bond passage, hopefully, God willing, on November 7th, we already have $10 million promised as a starting point. So we are already ahead of the game.
That's good. Hopefully it passes. So when is it again? November 7th.
November 7th. I want to emphasize that early voting started on Monday. I have already voted. I encourage everybody to please vote. I can't tell you how to vote, but please vote.
Please vote. It's much needed,
yes,
as we can see. So I recently learned about different programs that Harris Health offers, like Food RX, Food Pharmacy, what's the other? Community Farm, Culinary Kitchen. I had no idea of those programs. So how would you say those programs are fitting into the population health program, and what is population health?
Yeah, so thank you for asking that question. It's really important. It's one of the things, again, that I think separates Harris Health System from, you asked the question about the regular hospital, right? So
yes,
we really, our mission is to improve the health of our community. That's our mission, plain and simple. And I've always said that for us to be able to achieve our mission, improving the health of our communities, we are not going to be able to do that in our hospitals. The challenge is to actually keep our community healthy. It's about disease prevention and health promotion. And that happens outside of the hospital, in our clinics and our communities. So a few years ago, Harris Health System actually created a community farm on the LBJ campus. We actually have our own farm where we grow fresh fruits and vegetables. Twice a month, we actually have a farmer's market where we can provide fresh foods and vegetables, both from our farm and also from other food pantries and local growers to the community. But the food pharmacy program is, in our clinics, Harris Health System, we identify our diabetic patients and hypertensive patients who may be suffering from food insecurity. These are the people who do not necessarily have access to fresh foods and vegetables.
Right.
Our doctors are able to write them a prescription for food. The person in our clinics actually walks to our food pantry, meets with a clinical dietitian and a community health worker. They walk them through our food pantry, not only helping them identify the foods that are good for them, but our culinary medicine program, which I'm really proud of, is actually teaching our community members how to prepare those foods.
Wow, that's
the example that was given to me is that the Hispanic culture may not be familiar with how to prepare an eggplant, for example. But we actually have chefs who teach our community members what are some of the meals that they can prepare using eggplant, for example, that is healthy for them. And intuitively that makes sense, that would help our patients, but we actually have data that it does work. We have compared the patients who have participated in our food pharmacy program to patients who have not, in terms of our diabetes management. And everything else being equal in terms of their access to medication and clinical visits, patients who participate in a food pharmacy program just by having access to fresh food and vegetables, their hemoglobin A1C, which is the measure of their diabetes control, it is vastly better than those who do not participate in our food pharmacy program.
For sure, and I didn't know about it, and I was amazed when I heard about it. I have my son. He's 16. He's a type 1 diabetic. I know it's different from type 2. I mean, it's not really prevent. You can prevent type 1,
Right.
really, but you can prevent complications.
That's right.
From type 1 diabetes. So it's incredible when I learn about these programs, how, you know, all these diabetics and people with other diseases can benefit from these programs. It's incredible. And so definitely you are all about preventive care.
That's
and
right.
Preventative medicine, basically.
So we want to actually increase our focus on preventive care, right? So, you know, we started with diabetes and hypertension. We started in just 2 clinics in the hospital. We expanded to 4 clinics. By the end of next calendar year, we actually intend to expand this to all of our clinics. Also, we want to increase the focus now beyond diabetes and hypertension. We want to really bring focus to our pregnant mothers. So we want to actually include them in our food pharmacy program because we believe that actually that intervention is going to have an impact on our maternal morbidity and mortality, which again, this region suffers from.
Definitely. Dr. Porsa, do you have any last message or words for Que Onda Magazine and the Hispanic community?
Absolutely. I just want to say that, first of all, thank you. Secondly, I really encourage you to please vote. This is a really, really important election. As I've already mentioned, our bond proposal is on the ballot. Please vote. And second, and lastly, I guess, I want to say that, yes, we are the safety net hospital. Yes, our mission is to take care of those who need it the most, who would otherwise not have any access to care. But also want the Hispanic community to know that we are proud of that mission. We are here to serve you, and we are glad that we are in a position to serve. So thank you.
Thank you, Dr. Porsa. It's been a great pleasure. Thank you for your service. Thank you for your time. And thank you, everyone. Until the next one.
Thank you.